Talking about sex with foster youth is a conversation most adults and teens want to avoid. And in the child welfare world, this conversation has long been ignored. Too many of our youth are experiencing early pregnancy, STDs, and lack a trusted adult to have continued discussions with about sex. So Fostering Media Connections presents Let's Talk About Sex with Foster Youth, an open conversation about sex, relationships, and the value of love. This web series will devote a number of episodes to helping break the uncomfortable barrier of the sex talk and equip youth in care and the adults in their lives with the tools we all need to have productive conversations. This series will be educational, it will be honest, and it will be non-judgmental. A number of organizations have already been working on this issue, and we have two of those organizations represented here today. We have Cindy Kane of the Children's Law Center of California and Dr. Tony Heineman of A Home Within, which provides free therapy to foster youth. Cindy, I'd like to talk to you and start with you about the need for this talk. Why is it so important, and why do so many youth and adults need to have this conversation about sex?
Thank you, Ryan, for allowing us to be here. And you're right, it is a serious issue. And I think when you look at the numbers, it's very clear. Nationally, we're seeing a reduction in the rates of teen pregnancies, but that's not occurring in foster care. Youth in foster care, the rate is getting higher. This is a population of young folks who we are clear at risk of abuse and neglect, and because of that, aren't necessarily equipped to make proper choices, including those regarding their sexual health. When we're looking exactly at the numbers, youth in foster care are 2.5 times more likely to become pregnant. And when you're looking at that same group of young ladies, at 19, they're 46% more likely to have a second birth. Additionally, they are 2/3 of female foster youth are pregnant within 5 years of emancipating from the system.
Wow.
And so when you're looking at all those numbers together, it's very clear that we have to address it.
And Dr. Heineman, Cindy has told us the numbers, but can we go beyond the numbers? I mean, from your perspective, what is the importance of healthy relationships and the value of self-love? What does that have to do with these numbers?
It has a lot to do with these numbers, and I want to just add one number, which is that parents who grow up in the foster care system are 6 times more likely to lose their children into the foster care system. So I think that's a good example of what happens when you have unhealthy relationships and then can't parent a child.
Yeah.
So we want all youth, young adults, older adults too, to have positive, fulfilling sexual relationships. And that really depends on mutual respect and being responsive to your partner's needs and desires. But it also means having self-respect and being able to articulate what feels good to you, what kind of pleasure you can give your partner. And it really involves being very thoughtful about yourself and the other person you're with.
I've talked to a lot of youth about this subject, and some of them have actually said that because they started off not with the family that they wanted or that they felt they deserved, they may have planned some of their pregnancies because they want to start that family for themselves. Have you guys found that, or Cindy, have you found that in some of your research?
Absolutely, and I think additionally, we know that when teens in the general public are surveyed, they're very honest in that when they have a trusted adult or a parent they can turn to, they're more likely to use contraception, they're less likely to have an unintended pregnancy. And so just by mere fact of being in foster care, our youth aren't given that advantage. They don't oftentimes have a trusted youth or a parent they can turn to. With multiple placement changes, multiple caseworkers, they're lacking that. And so you're right, Ryan, they are creating that family, creating that sense of love.
So I know CLC has a really big reproductive health project about this. How are you guys equipping adults to talk about this issue with youth?
We're really fortunate that here in California, most of the jurisdictions are recognizing how serious a problem this is. So both in Los Angeles County and in Sacramento, we're finding parenting team collaboratives and work groups coming together. This is not only just to train social workers and attorneys, but we're partnering with the community. We're ourselves getting educated on what's available, what resources are available for our youth, so that we're better equipped then to provide that to our youth. as well as our judges, our social workers, our lawyers, our CASA workers are all receiving this continual training so that we're all equipped and we're all saying the same thing. And thankfully in Los Angeles County, because of a grant from the National Council of Family and Juvenile Court Judges and the Campaign to Prevent Teen Unplanned Pregnancies, attorneys and judges are able to provide condoms to youth in the courtroom when they come to their court hearings.
So, I mean, that means we have lawyers, judges, social workers, all in and being more aware of this issue. My last question to you both is, do you think they're the proper people to have this conversation with youth about sex? Or should it be someone else? Should it be a group of people? Who do you think?
I think it's about the relationship. It's not about the title of the person, what their function is, but it has to be somebody with whom the youth feels comfortable. Mm-hmm. And as you said at the beginning, adults are anxious about these conversations too. And if there are lots of adults, it's easy to just think, well, the next person will take care of it. I think the other thing that happens, particularly for foster youth who grow up and spend a lot of time in group homes, they turn to each other for information. Mm-hmm. And we've learned that youth don't always have the best information about sex and about taking care of themselves and about relationships. So I think, for example, if we have a youth in therapy through a home within, the therapist can have the conversation. And so I think it really is about the person with whom the young person feels comfortable.
I absolutely agree. I would say that anyone that the youth finds or believes to be a trusted adult. And I think what's interesting is that despite the perception of many adults, when surveyed, youth have said they want this information from an adult, not from their peer. And I think it's also important to keep in mind that within the state of California, youth over the age of 12, regardless of whether or not they're in foster care, have the right to confidential sexual health education and services.
Well, sounds like it's the relationship and not the title, just having that conversation.
Absolutely.
Thank you both for joining us today.
Thank you.